Hello, everyone, and welcome. Thank you for watching today. I am so pleased to be here with Diane Wilush. She is the CEO of United Cerebral Palsy, one of the largest providers in Georgia. Is that correct, Diane?
Yes, it is.
Yes, I thought so. Thank you so much for being here, Diane. And just know that as families, we appreciate what you do, and it must be extremely difficult during this time. So I'm very interested in finding out a little bit more about you and what you do on a day-to-day basis. So tell us a little bit about, think back. I know you're also a seasoned professional, and so think back, how did you get started in this field?
Well, first, let me say I really like the word seasoned rather than old professional, right? Actually, I have told the story many times. I, as a little girl, had in my first grade class a young woman who I will never forget, who had Down syndrome. And I was really interested in her. And obviously, because I'm older, this was way before public education. So, but the little town I lived in was pretty progressive and included this young lady, little girl, in my first grade class. And in my first grade mind, right, I knew that she was a little bit different, but I also really liked her, and we played together, we did recess together and whatever. Then had other opportunities as a Girl Scout to work with people with developmental disabilities in institutional settings, and became even more interested in them as individuals and didn't quite understand the whole institutional setting. So when I went off to be a social worker in college and pursue my career, that was my area of focus and has remained my passion and interest since the 70s.
So that is really interesting. You can look that far back, right? As a young child, and that really shaped your perception and your work. That's really wonderful.
Well, and I think it also kind of demonstrates what our work these days, right? With people in the community and exposure to others, so that relationships are built and interest is built. And so it's kind of a playing out in the latter part of my career that's where the field is going anyway.
That's great. So it has been an evolution.
Oh, for sure.
Yes. So tell us a little bit about United Cerebral Palsy, because I think that, first of all, you cover Georgia and South Carolina, right? I mean,
right, but they're two separate organizations.
Okay. And you serve not only individuals with cerebral palsy, but with developmental disabilities, correct?
Correct. Okay. That's an understandable common misunderstanding, is that we do serve and have always served people with all developmental disabilities, intellectual disabilities. It's really hard, as you well know, to kind of sometimes parse out what, for people, certainly people that have multiple conditions, to parse out, which came first, the chicken or the egg, or, you can't just focus on one part of the person. You kind of have to deal with the person as a whole. So that's why the UCPs that I'm responsible for, as well as UCPs around the country, really do serve people with an array of disabilities.
So what is the day? Can you tell us a little bit about the day-to-day operations? What is that like? Give us a flavor.
Well, we are a statewide organization in both states. Obviously, we'll talk about Georgia. So we have services in big pockets around the state. So our reach is pretty deep and far. We offer an array of supports and have a real interdisciplinary team approach to supporting people. And obviously, try always to be very person-centered in what the individual and their support system vision and want in their lives. We do serve mostly adults in our population, although we do some CLS supports with some younger individuals around the state as well. So, the day, there is no standard day. It's because of the nature of our work, and people are changeable, and all kinds of things happen between now when we're dealing with COVID and where we're having instances of positive cases popping up, and how to manage through assuring that people are safe and staffing is adequate or beyond adequate. And also looking, we have a behavioral support component within the organization, and we are seeing a little bit of increase in I think that these are situational behavior kinds of things, and concerns of people just struggling with, for those we support residentially, for them to they've been at home since March 16th. And we literally, unless it's a doctor's appointment, nobody's going anywhere, which is really, really hard. At least some of us are going to the drugstore or the grocery store, go out for a ride and so forth, and that's not happening. So there is no typical day. I wish I could tell you that, but it's managing services and assuring that we're staying true to our mission of supporting people in a way that kind of removes boundaries. It's a life without limits is our mission. And so it's keeping that overarching philosophy in operation every day, and then dealing with all the multitude of things that happen to people, not only those we support, but also our direct support staff, which are the center of our work. And so we are always mindful of how we can support them to assure that they are comfortable in doing the essential work that they do. And then another hat that I wear is I try to engage to a great degree in advocacy for just all providers, which really means all people with developmental disabilities as well, because what we're advocating for, while some people may think it's provider interest kinds of things, they really are things that do impact people supported by IDD organizations.
So just going back a little bit, so just to unpack that a little bit, so you serve the entire state of Georgia. The geography. So
Correct.
You have, yes. Okay. And what is the average age of the adults that you serve? Could you give us a guess?
I would say the average age is probably mid-30s to mid-50s. So what would we say, maybe in the early 40s as an average, but we support people that we're so delighted to support who are in their late 70s and even someone in their 80s. So we're really happy about that, obviously. And then younger people as they're moving out of the school system into community services when they're no longer eligible for public education.
Right. So, and how many individuals do you serve?
That's always a little bit of a fluid number, but about 300 individuals around the state of Georgia.
Okay.
And the bulk of those, because the bulk of our work is residential, although we do provide other services, but traditional group living for 3 or 4 individuals, and host home option for people who are interested in that method of service delivery, and a little bit of CLS and then day supports. It is the number always kind of is fluid, but those services are around the state.
And obviously you talked about COVID. That is the topic. That is our day to day. So, and then the shelter in place was just extended again. You talked about individuals not going out at all. So it was extended to, I believe it was the 31st.
Correct.
Yeah, 31st. So what has been your biggest challenge during this time?
Yeah, I would say, well, initially we had we call it a positive home, because an individual in a home became positive in the end of March. So it was really early on, which kind of took us a bit aback, of course. So then the initial struggles were not only back then, PPE was challenging to obtain, and working with the direct support staff to build their confidence, to assure them that we had the materials they needed to keep them safe, and that they could effectively support the individuals in the home through their period of being positive. And it was really kind of a domino effect, because the one individual became sick, was admitted to the hospital, thankfully came home, no ventilator, completely fine. But in the interim, while she had been in the home before we knew she was positive, the virus went to the other 2 individuals in the home.
Gosh.
So it is that domino effect. So we managed through that first experience. So we thought, well, okay, if it happens again, we'll be able to deal with this. And I have to say, I just could not be more proud of our direct support people. They are truly remarkable. We say that in non-pandemic times, just in ordinary times. And then to see how they supported people through this episode and the other ones that we've had is really, really remarkable. So I don't know what, no organization could exist without them. So we've made it through that COVID episode. We learned some things. We incentivized staff to go work because we knew they were leaving their families. They had the potential of bringing the infection back home to their own homes. They have complex lives, second jobs, caring for elderly loved ones in the home. So we were super sensitive to those issues. And again, education and, a financial incentive to acknowledge their heroic efforts to really step up and do the work. So what we've seen since this, so that was the first episode. Then the state really kind of opened up. What was that, in late April, early May, right, when, things really started to open up a bit. And our internal team, that kind of is the SWAT team, so to speak, for this event. We were really concerned because we thought, this is not going to be good because staff are going to feel like they're not going to be as attuned to minding their personal behavior while they're still working, so that their lives, they're going to the salon, getting their hair done, maybe going out to eat, doing things that they didn't have the opportunity to do before. So as a result of that, we've kicked up to a kind of a rolling average of 3 to 5 homes, I would say, at any given moment that have positive people in the home. This is not an issue of fault because people have lives to live, but clearly the individuals aren't leaving the house. So we know where the infection is coming from.
Right.
Yeah. So we just have to manage for that. And we do, again, it's ongoing kind of very positive messaging to our direct support team to kind of remind them that not only a bit of a responsibility for the individuals we support, but also to their coworkers and to themselves, that this mindful, safe behavior in their personal lives will enable us to keep everybody safe and to keep them safe.
Right.
So it's a balance. You can't control people's lives. So from there, we manage this. We have like I said, the SWAT team of our director of nursing, our director of behavioral supports, day program personnel, HR people, finance people on a team call twice a week where we review the medical status of everyone. And then we actually do that between the two states because we're learning from each other. So that's one of the benefits of our structure. So we do that twice a week. We run through all the medical status of everyone. We run through HR issues with respect to personnel, operational issues, PPE, all of that kind of stuff, and then financial issues just to kind of keep everybody abreast of how we're standing in that regard as well in managing for the pandemic.
Have you had any individuals that have had to be hospitalized?
The one that I mentioned from the very first issue in March, and we presently do have someone in the hospital now in the Macon area who, and kind of ironically, a bit of a younger person. So it's got us kind of a little bit stumped, but he seems to be perking up and doing well. Okay. So we're hopeful that he will be home soon so that we can support him at home.
So how have the hospitals been to work with in terms of having a support person there? Has that been an issue for you all?
Yeah, kind of hit and miss. It depends on the community, really. And again, we only have the Clayton County issue, and now we're in Bibb County and Macon. So with hospitals, and our director of nursing, who we're fortunate enough is a nurse practitioner. She has been able to navigate relationships with like shift nurses and the charge nurses wherever the individual is. They have not been terribly welcoming about
Mhm.
having a staff person, and even when we're not in this circumstance, just normal operations, at the very least, we like to have staff people there during meal times and some downtime for the individual, because the hospital experience is so stressful in and of
Right.
itself.
Oh, yeah. Yeah.
So that's been a challenge, but they have been very accepting of the guidance and support of how to support the individuals that are there.
Okay, so
So
that's
it's
good.
not
That's positive.
ideal, but it's
Yeah.
not horrible.
Okay. Okay. That's good to hear. And how have you kept family members connected to their loved ones during this time? I know that is a challenge as well.
Yeah, that has been a challenge. And again, learn by doing. None of us have lived through this before, so we're learning as we're going. But we, quick like bunnies, made sure that we had video access on all the computers in the homes, which was an addition because some places didn't. They were older computers. So we got everybody cameras, got Zoom installed for everybody, and had that resource available to families. We've also asked that in every location that the staff work with the individual and support FaceTime calls or Zoom calls or whatever, at minimum weekly. And as with anything, there's some families that are very tight and connected to each other, and so we do more of that. And then there are families that, as their adults gotten older, their adult child, maybe talking every other day isn't an issue for them, that they prefer once a week is good, and that's what they do. So we've offered the array of opportunities to try to connect people that way. Also sending them little videos of things that are happening around the home during the day, so they can see that their person is being engaged. And we were right from the get, everybody's getting up, getting dressed. It's a normal day. You're just not gonna, we want to encourage people to have as typical a day as they might have had otherwise, but absent leaving the house, right?
Right.
So,
So hard. Yeah.
while we all like to lounge around sometimes in our PJs, that can't be what we do all day, every day.
Right. Yeah.
So we've been real supportive of getting people up and moving. And I just got a video this morning, actually, from a home in Columbus where staff had gone and gotten a badminton kit, and they put the badminton up in the yard, and the video of the guys out there doing badminton and being in the fresh air and being physically active and that kind of thing.
So important. Yeah.
So we send those kind of videos to families too. We have offered visiting outside.
Okay.
So like, the back patio, the deck, the driveway, whatever works and is accessible for everybody. Again, with social distancing, keeping the mask on, keeping, the 6 feet distance. And for some families, that's very meaningful, and they take advantage of the opportunity to do that as well. We're kind of presently struggling with some folks really are so eager and need home visits. They need to be able to go home. And so we're trying to balance, how do we want to respect that and we want to support that, but how do we do that in a way that's safe, not only for the person that's going home, but for when they return, and the potential that they could have the virus and now infect a whole other group of people.
Right.
So we're sorting through that, and I've kind of landed on a case by case kind of situation, looking at those family circumstances where people are really asking because it's so important to them, and we want to be sensitive to that.
And it's such a tricky situation.
It
really is.
It is. And we have our compassionate provider hat on, but we also know, which is kind of the driver of what we do, but we also know we have another responsibility and obligation to funders and the state system to be as uber cautious as we can be, and we feel that weight too.
Yes.
So we're mindful of all the audiences that we work with.
So we have COVID going on. That's one thing, huge.
Right.
And then in addition to that, budget cuts and deep budget cuts as well. So will UCP, are you all affected by these cuts?
Well, interestingly enough, we are not.
Okay.
Interestingly and fortunately, we are not. We are really, our primary source of resources to support our services are the waiver and fundraising. So we were not an organization that had any amount of state grant and aid dollars, which is the dollars.
Yes.
So for us, we're okay. Well, we're not okay. We didn't get impacted by that. But I am very knowledgeable and aware of the impact that this has had on organizations throughout the state, and certainly for families, because they bore the brunt of the cuts, right?
The family support, right?
Yes,
yeah.
Well, family support or day services or whatever it was, the individual has no service. So that trickles back to family as well. So we are doing a lot of advocacy through SPAD, the Service Providers Association, around that very subject. So we're hopeful that we can make an impact. And I think, I appreciate connecting with you and the family members that follow with the great work you're doing with these chats, because I think we are a collective of people. It's not an us-and-them situation. And obviously we're stronger voices when there's two groups, but that when those two groups work together. So we're working to make those things happen and see if there can be some changes, some dollars restored, and those kinds of things, because we know there is an infusion of money into the state through an increase. Okay, so the Medicaid match went up, and there's been just what do I want to say? COVID relief dollars that generically went in a big bucket to every state. And I recently saw some data that Georgia has only accessed and spent, I can't remember exactly, but it was someplace in the mid 20% of those resources. So they certainly could be redirected to IDD services, who sometimes we feel like are the last people thought of in the scheme of government, right?
Yeah, so that's for sure.
I could prattle on about all of this. Just tell me to stop.
So advocacy, I can tell you have a real heart for advocacy. Are there any other initiatives that you want to tell us about in terms of the advocacy? I know you had a big push. Again, you're a real advocate for our DSPs. And so, is there anything that you want to tell us? Yeah. Actually, there's two things I would like to share with you and your audience, and also share some paper information that you could post if you're willing. Sure.
The first big effort that SPAD has been engaged in is the development of a campaign called They Deserve More. And we have a website, They Deserve More Georgia, and a Facebook page. And we would encourage people to visit those places. And on Facebook, certainly like us and share it throughout your networks. Our objective here really is to educate the community at large, kind of a grassroots effort to help people understand the importance and value of direct support professionals, not only in the lives of all of us that do this work and live with a loved one who may have a developmental or intellectual disability, but also to the community at large and the value of their work, and help people understand that they are potentially, while maybe not the same arena, they're potentially a car accident away with a child from having a child with a disability, or taking care of someone who's had a stroke. Again, not our population necessarily, but the growing need for caregivers in our world, in our country, is dramatic. It's truly a crisis. And what we are concerned about is the best outcomes for people come from the most stable staff. And if we can't keep staff stable, we don't have the best outcomes for people. So Georgia, National Core Indicators have said Georgia documented a turnover rate of 41%. I mean, that's
very
frightening.
High. Yes.
That's frightening. And we can't compete with the private sector, with Target or Walmart or wherever at $15, $16 an hour. The staff that work with us are people who have two or 2.5 jobs, 1.5 jobs at least, and families that they're supporting. They are the working poor, and we need to do better. So this They Deserve More is an effort to tell the story of DSPs and why they're so important, and DSP wages will be the cornerstone of SPAD's advocacy till we get us up. So we will make this our one and essentially sole primary legislative issue until we see some kind of resources directed specifically to direct support professionals.
Okay, that is really great to hear. That's great to hear, and I'm happy to share the information with everyone on the page.
Okay, and then if I could tell you just the other.
Sure, absolutely. Yeah, please do.
The other thing that we're really working on, and actually just kind of wrapped up the package, so to speak, last night, is that many people may be aware about retainer payments and CM, how that's been an up and down roller coaster, right, since March. But it seems like the dust has settled and we're really dealing with 90 days of support. And what we are very concerned about is what will happen to infrastructure in a very short time. It could be, 90 days was over in the end of April, mid-May, right? There are smaller organizations that are not going to survive. They are not going to be able to keep the lights on and pay the rent or mortgage to have supports available once this is over. So CMS has the ability to go beyond 90 days. And what we brainstormed about is how can we impact this on a federal level, because it's not a state issue. It's not something DCH or DBHDD can solve.
Yeah. So
we need to impact this on a federal level. So what we have done is worked with people that are legislatively savvy and engaged some support we have crafted legislative language that we want to see be included in the HEROES Act. And really all the legislation does is it directs CMS to go beyond 90 days. In whatever fashion or formula a state may apply for via the Appendix K. So let's suppose, just as an example, that Georgia may say, we want to fund through the end of the pandemic, retainer support services to 75% of average attendance or 50% of average attendance, whatever it might be, or we want to pay the rate, whatever the situation might be. We just need CMS to open the door. States can determine how they're gonna enter that door, but we need CMS to be directed to go past 90 days.
Okay, so CMS is the advocacy point. And why do you think they changed it? So that is positive. At least they moved it to 90.
Oh, absolutely. Yeah, absolutely. That's good stuff.
Do you think that it's just a wait and see, that they're waiting to see but we know this is going to last for, more months than we would like, for a while. Yeah. I don't know the politics and the backstory on the position. I think there is probably some thinking about the efficacy of funding services that aren't provided. And I get that from a taxpayer's point of view. In all fairness, I do understand why the appearance of that is a little iffy. But on the other hand, I think that once you understand the complexities of the system and the necessity to be able to assure that there is infrastructure and that there are employees to be able to bring back if they're gone, they're off to Target or Walmart working. So we really feel that this is where we need to go. We're part of a national organization as well, ANCOR. SPAD is the state association of ANCOR. ANCOR has already written to the SPAD administrator, Administrator Seema Verma, to ask that she change her position on this. But we're going to do the safety net and try to get this legislation plugged into the HEROES Act. And one final point about this, which we think makes it a very easy sell, is that this doesn't cost any money. It's just a direction given to CMS. People have funds on their PAs. These services have been authorized. The funds have been encumbered in the state. So we're not asking for money. And so that makes it, we think, a very viable sell. And I'm happy to share that information. And if people wanted to talk to their legislators about supporting the inclusion of this in the HEROES Act, we would really appreciate the help. Yes, please send that information to me. And I know that advocacy is just it's a large part of what you do. So, so tell us, as professionals that are watching, as parents that are watching, how important is advocacy in your work?
It's about everything, right?
Yeah.
I mean, aside from the day-to-day of DSPs and the people we support and keeping that system whole, without advocacy, we can't do our work, whether it's um, for participant-directed work, whether it's in-home family supports, whether it's residential. There's all flavors of ice cream for a reason, because it meets individual needs in different circumstances. But we all need to be together on the fact that we need to assure that that services in this population are not forgotten. In the scheme of the state budget, we may not be the biggest rock on the beach, but a very important one. And so we spend a great deal of time in education to legislators about how important this work is, and advocating for resources to support the needs of the system. I would be one that would say that this system has been poorly funded for a couple of decades.
Right,
So
right, absolutely.
so
the work never ends. The advocacy
no, it
never
doesn't.
ends.
But that's, I think all of us that are in this arena, no matter where you sit, are passionate about the cause, and we just need to be pounding the pavement and making our voices be heard.
Yeah, it's like pushing that boulder up the mountain, right? But
it's
it definitely worth
end,
it.
Right?
It is
right?
definitely worth it. Yeah.
It's true. Once you think you've got one issue solved, another one pops
Something
up.
else pops up. Well, certainly in the last 6 months to a year, a lot has popped up. So thank you so much, Diane.
Oh, you're very so much welcome. Thanks for inviting me.
This has been a lot of fun. I've learned a lot, and as I continue to always learn from having conversations.
We all do from each other.
Yes, we do. Absolutely. And I really appreciate how you look at it's not the us versus them mentality is just not going to work, in terms of families, providers, individuals. It's just so much better when we all work together. Yeah. Yeah, absolutely. Well, thank you so much.
Absolutely.
And you take care and have a great rest of your day. And
I'll
send me any information.
I'll send you info.
I'll be sure to post it. Take care.
I sure will.
All righty. Bye-bye.
Very good. Thank you. Bye-bye.